All right, so let's go ahead and shift over to what we did in the Social Services Budget Committee. We're going to walk through just some of the amendments that you offered in committee that were added on, and now it's still going through the process, so it's not a guarantee that all these amendments may or may not make it onto the budget at the end of the day. But can you at least explain all the amendments that you added on, and how it's going to benefit Kansans at the end of the day?
So the overall thinking is that there's this big push for Medicaid expansion, ensuring another 150,000 able-bodied Kansans. And we can't even take care of our own. We have hospitals that are in trouble. Rural hospitals especially are having a big deal. There was a deal on Fox the other day about how many hundreds of hospitals across the nation, even in states that had expanded Medicaid, that were in danger of closing, not just in Kansas. So that's one of the myths about Medicaid expansion, is that it'll save rural hospitals. But what we started down the road of is increasing our Medicaid reimbursement levels to our hospitals. Our Medicaid reimbursement levels were very low, to say the least. And so
what is a Medicaid reimbursement level for those that are listening out there?
It's the amount that the state and the federal government pay to hospital providers for their services. And our services were incredibly low. So actually started this in the summertime and started working with the hospital association to address that. Woke up in the middle of the night and thought, we need to do this. Got a hold of the hospital association. They provided me with some numbers that confirmed what I thought was how low they were. And so then we went into the process with KDHE of raising across the board. And so this year, in our budget, we raised the physicians' rates by 15%. That was the recommendation, was to raise that by 15%. And the hospital rates, outpatient rates, by 30%. So just to give you an idea of what that looks like, on the hospital rates, it would be adding $45 million all funds, $17.9 million SGF to raise the outpatient rates by 30%.
Okay, so here let's unpack it for those listeners that might be unfamiliar with our budgeting process a little bit here. So when we start talking about all funds and SGF, so what is all funds and what is SGF?
So SGF is the state portion, and then we do 40%, and then the federal government does 60%, roughly. So 60% of the money we're talking about is from the federal Medicaid program, and then the SGF is 40%.
So SGF means State General Fund, and so that is the money that we as the legislature can control. That is taxpayer dollars that we control, and we can spend it where we want.
That's right.
The all funds is federal government money, or money that's coming in that we don't necessarily control, but it's like you said, it's going to match something. So we're drawing down those federal funds in order to increase the funding for this organization.
Exactly, and it's roughly a 60-40 split. So every dollar we spend, 40 cents of it's ours, 60% of it is the federal government. So that was the hospitals, and then the physician rates add $33.9 million, including $13.5 state general fund, to increase the physician provider rates by 10%.
So what is going to
15%?
So what do we think is going to be the result of increasing these amounts to the providers and to the physicians?
Well, the bottom line is it's going to provide more access. We have a ton of providers that don't access the Medicaid program because they lose money on every person that they serve. And so this will provide access for our folks that need Medicaid services at a better rate than it was before.
And so we've actually done a whole podcast on Medicaid expansion specifically, but really what this is talking about is those 13 populations that are already currently within the Medicaid population without adding the healthy adults. So this is the children, the elderly, the pregnant mothers. This is the people who absolutely need these types of services that we are now funding more of these slots, I guess you could say, or we're funding more of these physicians, and so they're willing to accept more of these patients. So I guess in a way we are expanding Medicaid, but only to the 13 at-risk populations that currently exist. And so we're actually targeting the services and the money to the populations that it should go to instead of healthy, able-bodied adults, right?
That's right. We need to take care of our most vulnerable people, our children, our ID and DD folks, all those folks before we even think about that. It just makes no sense to me to expand when you can't take care of the people you're already tasked to take care of, and then expand it to another 150,000 people. That makes no sense.
Well,
whatsoever.
and there's even been some who've said, that 150,000 is actually way under. It's more like 300 to 350,000, and so we'd be putting that population in with this other 13 group population. And if there's already physicians who aren't taking Medicaid patients because the reimbursement rates are too low and it's not profitable for them to take on, 50% of their clientele is Medicaid, then we would just be adding and harming the system even more.
That's right. And almost and keep in mind that the physicians want to treat people. They want to do that, but they can only lose money on so many people and still pay the bills. And that's it. They want to serve these people, but when you're losing, when you're getting reimbursed at half the cost that it takes to provide the services from Medicaid, how many patients do you want to take on?
Well, it's, I think, simple and basic economics and business. I mean, if you're operating at a loss for every person that you see, then you're not going to be in business for very long.
Exactly. And they want to take care of these folks, but they just can't afford to. They still have to pay the bills. They still have to pay their staff, their electric bill, their insurance,
all the
that
medical
kind of
debt that they got from college and school. Yeah.
Exactly.
Yep, exactly.
So it doesn't take a rocket science to figure that out.
No.